So now we're going to be talking about, we've covered the thigh, right? So what do we use for the word for down here? And then what's left at the very end of it? Okay. So, what are the bones that make up the leg? And fin, right? And then, you think we're going to have to know different landmarks on that? And those are going to we're going to know those because you need to know the origin insertion points and then also landmarks for point location. And what's the thing that connects the two bones in between each other? Interosseous membrane, right? Okay. And the tib and the fib, what points do they articulate with each other? It's going to be up here, proximal tib fib and distal tib fib. And then also this is kind of a functional joint in between here where the interosseous membrane is. Okay? So on this, the top flat part of the, I'm going to grab the skeleton. No skeleton.
So that's two? I forgot to tell you, he went to the symposium.
What's that?
He went to the symposium.
No, actually.
Yeah, he got passed.
Mine. Okay, well, we're going to have to wing it. All right, so you have these lateral and medial condyles. On the femur, if you remember, it's more of a rounded surface. And then on the tibia, the top of it it's more like plateaus. We call it tibial plateaus, medial and lateral plateaus even. So that's where this flat part is on the top. And then in between there's two intercondylar eminences. And what those are spots where the ligaments are going to attach. We'll talk more about the anterior cruciate, posterior cruciate. Okay, if anybody follows different injuries, knee injuries, or football or anything like that, you hear a lot about MCL, ACL, PCL, LCL, things like that. So we'll talk more about those. And then here's the head of the fibula. Okay, we mentioned that before. You can palpate that. That's where the attachment of, what's this muscle here? Biceps femoris. So that's going to attach pretty much at that fibular head right there. So that's a pretty easy landmark to find. And then, what's this other one on the front here? Tibial tuberosity. Okay. And tibialis anterior, that's a muscle. And tibial tuberosity, that's going to be this little bump right there. Okay. What's that? Yeah, I mean, it's easier to find right here. You know, this big bump. You follow your patella, follow the patellar ligament right there. Okay. Tibial tuberosity, can't miss it. Okay. And then you have, if you go down the front of the tibia, you can feel this kind of a ridge or a crest, right? So that's the anterior tibial crest. Okay. If you ever bang your shin on something and you hit the bone right there, that's what that is. Right? I might have used other words besides anterior tibial crest when you hit that. Okay. Darn that tibial crest. So then, along the lateral side here, what do we have? Fibula. Okay. And then the fibula forms the lateral malleolus. And then on the medial side, you're going to have what? Medial malleolus. And what bone is that? The tibia. Right. Okay. So that's on the anterior surface. And then on the posterior surface, there's not much more to mention than that. Right. Obviously, you're not really going to palpate these intercondylar eminences. But if I had a skeleton here, I would flip it down like this, and you'd see these two little tips. And that's where the intercondylar eminences. And you'll see I've got some slides that, oh no, they're in here. Okay? Basically, they're what the anterior and posterior cruciate ligament attached to. So then the main things you're going to know on the tib and the fib is the tibial tuberosity, the medial and lateral plateaus or condyles, epicondyles of the femur, the tibia. Because the tibia is obviously going to be the main bone in the lower leg. And the tibia is part of the knee joint. The fibula is not really going to be participating in the knee joint itself. Okay? And when you're palpating, if you come down from the patella, you come into these two little indentations, which we call the eyes of the knee, or I think in Chinese medicine they have a different name for them anyway. But you can go up from that and you can feel that rounded surface of the femur, the femoral condyles. Remember, those are the rounded ones, whereas on the tibia, it's more flat. And then you're just going to feel this ridge right here, what we call these two tibial plateaus. Okay? And then if you come to the lateral side and go down, then what's this right here? The fibular head. Right. Okay. Okay, so the fibula is not really a weight-bearing bone. You can almost do without the fibula, but of course it's going to stay there. But you ever eat like a chicken drumstick and you find that little bone that's inside of there? That's if chickens have fibulas, that's what they would do. Okay, so now we get to the foot. Okay, this one's more in the shape of the way that the foot's going to look. And this one's more kind of a disarticulated bag of bones kind of. All right, so let's talk about some of these things on the slides here. I don't have any pictures to go along with that. But, well, actually, so here, I do have the foot. So let's talk about the foot first. Okay. So remember, you have in the hand we had carpals, right? So now the counterpart in the foot is going to be the tarsals. So that's going to be these ones right here. Okay. Then you can have the calcaneus, the talus. Calcaneus is basically your heel bone here. That's the main bone of the foot, at least the rear foot. Okay. Then you have the talus up here. Right. And then coming along the side here, you have the navicular. Okay. And then you have the first, second, and third cuneiform. And then on the lateral side, you have the cuboid. So as you come from posterior to anterior, you have the calcaneus, which is all the way in the back. Then the talus is the one that articulates with the tibia and the fibula. And then coming forward in this, if you call this the proximal row, kind of like what we did in the hand, you have on this side, you have the navicular, and then this side is the cuboid. Right? The cuboid goes all the way to the fourth and fifth metatarsal. But on the medial side, for the first, second, and third metatarsals, you have the first, second, and third cuneiform. Right? So on this side, you have two rows of tarsals. On the side of the fourth and fifth metatarsal, you only have one row. Okay, so you just have this cuboid right here. But on this side, you have the navicular, and then another row of the cuneiforms. Okay. And then, what are these here? Metatarsals, right? And then phalanges, and then the same deal as in the hand, right? On the big toe, you got 2, and the other ones you have 3. So that makes how many? 14. All right, so then now the joints of the knee. Right? Obviously, from above, you're going to have what? The femur, right? And then those going to have the rounded femoral condyles. And then on the tibia, you have those two tibial plateaus, or the tibial condyles, and that's going to articulate between the femur and the tibia. Okay? So like I said, the fibula doesn't really participate in the actual knee joint itself. It's kind of off to the side. Although, if you talk about all the joints of the knee, usually the proximal tibiofibular joint is thrown in.